It's March 2025, and I'll link to the playlist below, but this video is going to be a recap of where I am in my battle with prostate cancer. Just to summarise and briefly, I was diagnosed in 2018, in the autumn of 2018, as having a prostate cancer. That was after going to the GP and suggesting that I had problems peeing, and that very soon transpired to be significant. I had cancer which had escaped the encapsulation of the prostate, was infecting or involving the seminal vessels, and also was damaging nerves, and it was in lymph glands. I had surgery. I had a robot assisted nerve sparing radical prostatectomy under the guidance and supervision of Professor Christopher Eden in January of 2019. So, that's 6 years ago. The good news is I'm still here. Let's focus on the good news for a minute. I am still here. The surgery was ostensibly, and at the time, thought to have been successful. There was no follow-up radiotherapy, no salvage radiotherapy, nothing like that. None of that was considered necessary. And so I very quickly got on to recovery from the surgery, which did take a long time. It was really hard work. I was in a lot of pain and had a fair few side effects to deal with. But 6 months on from the surgery, I was able to kind of resume a fairly normal life. Although I did have some artifacts of surgery. For example, my continence was affected, stress continence I think they call it, or they should call it stress incontinence. Erectile dysfunction, they nicely call it. You just got to live with that. And pains in my legs, and that was to do with, I believe, 16 lymph nodes that were removed, and the inability of the sort of inner thighs and groin area and hips from being able to properly drain. And so yeah, there you go. Regular PSA testing continued after the surgery for every 3 months at least, as a maximum really, over those first couple of 3 years. But it was clear after maybe the first 18 months that the PSA levels were rising again. And those PSA levels rising, of course, if you don't have a prostate, you shouldn't have any PSA in your blood, and therefore you shouldn't be able to read it in a blood test. But we were seeing PSA in the blood, and we were seeing it very slowly rise. And I took advice from my surgeon and GPs and urologists and oncologists and so on. And they concluded that there was a critical mass before it would be detectable by anything other than blood tests. So although we knew we had prostate cancer cells which were growing somewhere in my body, we didn't know if they were dangerous to me, or I think it's called malignant, and we didn't know where they were growing in my body. The testing is a PET-CT scan, which will be done, or should be done, when the PSA readings in the blood reach 0.2. Now that was exceeded about a year ago, and we had some discussions about whether or not we should do those those tests and scans and things at that moment. And personally, I'd have preferred if we just got on with it. But the feeling was that it would actually be very difficult, even at those technically detectable levels, to be specific about where the cancer was growing. And as I understand it, it could be in any one of a number of places. It could be in the prostate bed, the tissue that was left after the prostate was removed, so that was adjacent to it. It could be there. It could be in the scar tissue. That's a possibility. It could be in the bone. Or it could be cells that escaped via the lymphatic system that have found themselves somewhere else to grow in my body and actually making a mass of cancer. And because that's such a general situation to be in, it's an unknown, we have to try and locate it so that we can come up with a suitable plan of attack, a way of dealing with it. And that's can't be done at this early stage in the readings. Now, if you're a guy of 60 years old, as I am, and you have a PSA reading of 3 or 4 or 5 or something like that, and it's stable, you probably have nothing to worry about. You ought to check those figures. I'm doing that from memory, but I seem to remember the scale that it moves in. It's kind of non-linear, fairly flat to start with, but then starts to climb as you get older. But at 60-ish, it should be in the low single digits, if I remember correctly. And if that is the case, and you haven't got any symptoms, you're probably fine. Good on you, mate. If it's higher, then it deserves investigation. If it's lower, then it also deserves investigation, but for the completely opposite reason. Like, you should be, as a normal adult male, you should be producing some PSA unless you don't have a prostate. If you don't have a prostate, you're not going to be producing any PSA. But if you've got prostate cells in your body and they're cancerous, then you'll be producing PSA. And that's the situation I'm in. Sometime in the next, I don't know, 6 to 12 months, I imagine, I'm going to step into the realm of being tested. We're going to do what the doctors are calling restaging of my cancer. So they'll be looking to locate it, to type it, categorize it in its severity and its extent and how pervasive it is. And then with all that kind of information, the urologists and the oncologists and all the other ists who get involved in this thing will advise me on the best way of dealing with it. So that's where we are at the moment. I have to say, it's not really worrying me. I don't have any symptoms that there's an issue going on. So from that point of view, I'm just carrying on fairly normally, although my life has changed a lot since I had surgery. I lost a lot of physical strength. I also had some mental health problems after the surgery, and we also had lockdown. And if you put all that lot together, and my wife had to have surgery for cancer as well, a year after I did. And she had her own battle with recovery and so on. Thankfully, she's okay now. So not surprisingly, yes, I had some mental health problems, and I'm still being treated for that every day. And that's something which I'd never, ever had an issue with before. And in fact, I had great difficulty understanding mental health issues in people until it got me. And all I can say is, if you're going through this, whether it's before or after surgery, and you feel like you're struggling in any way at all, I thought I had acute anxiety. And after they sat down and talked to me and kind of leveled me out, they told me actually I had acute depression. And yeah, it was a surprise to me. I don't claim to understand it at all, but I do have a lot more sympathy and empathy now for people who are going through mental health problems. And, you know, please, if you're struggling, just go and ask for help. They are incredibly good. Everyone I met in that journey was unbelievably good and helpful and honest and genuine and polite and understanding, and they genuinely wanted me to be better, and they did it. What else? Continence, even at 6 years, I still have stress continence. We're not messing around here. I'll piss myself at least once a day. Sometimes just a little bit, sometimes, oh dear, go and get changed. And for me personally, that's just what I have to live with. It's not going to get any better, I don't think. I have had all the physio and investigations, and I was offered some tablets for it, but which I did take for a while, but they were cruel. They did some funny things to me. So they just didn't work for me. I decided it was easiest to live with the problem. And it's just a problem. It's just a symptom. It's like stubbing your toe every day or something like that. Other things you have to live with are the thing I mentioned. I have weakness in my legs, and I have a lack of stamina. I used to cycle huge distances, you know, at least 4 or 5 times a week. I'd get on my bike and I'd be riding anywhere from 30 to 150 miles on each occurrence and loving it. And it was easy. And since my surgery, I've not been able to ride a bike. It's just way too uncomfortable. And that's just an unfortunate side effect of the type of surgery and the rearrangement of my organs down there. I used to mountain climb, rock climbing, big granite faces and things like that. I've done some indoor climbing since, and it's good. The thing about climbing is it's kind of slow, and you don't necessarily need a lot of strength. You need a lot of technique. So thankfully, I'm still able to do that, although some of the more stretchy moves are too much of a stretch. But I can still enjoy that. I don't work anymore, really. I've accepted the combination of the surgery and its after effects and my age and lack of stamina have just added up to a point where I have to capitulate to it and find myself a fulfilling life without a 9 till 5 job. Not that I ever really did a 9 till 5 job, but you know what I mean. It's no longer the most important thing in the world. Me, the wife and the dog, and getting out and enjoying ourselves and making sure we make the most of every day that we've got. That is without doubt the most important thing. So there's that. What else? What else can I tell you? It makes me sad to think of the things that I can't do anymore. But at the same time, it makes me very thankful that I can continue to enjoy the things that are important to me, the people that are important to me. And that includes you lot, because I did a lot of consecutive videos shortly after my surgery, during the recovery, when I kind of had time to contemplate and sit and talk to the camera. And it's been like 5 years since I last did an update like this, and you've all been asking me. I get messages still all the time on those YouTube posts. So this is for you, the people who have thought about me. I'm okay, thank you. I replaced my bicycles with four-wheel drive cars, and I do a fair amount of off-roading, things like that. And I also build the cars, and although I don't share this on my other YouTube channel, if you want to see what I'm doing over there, you can go and look up Steve Steele, and I'll link to that in the details below, and you'll see what I'm doing with my time, how I entertain myself. As you can probably tell, this is, even after all this time, this is not easy to talk about, and I've found myself a moment of solitude and distance from family and friends to make this video, because I don't want to burden them with it. I think I might have said that before, a long time ago. And I've spent the last few years trying to enjoy life, but it's never stabilized, and I think that's actually one of the reasons why I've never felt I could sit down and make this video, because you want a plateau to discuss it in, so you can talk about what's happened and maybe what the future holds. But I don't know what the future holds at the moment. This is a kind of funny limbo, funny, not very entertaining limbo, which I prefer not to be going through, quite honestly, but I am. All I can do for you is promise you another update. As soon as I know anything, I'll let you know, and encourage you to be strong, and encourage you to ask for help. I don't know how much help I can give you, but there's a lot of people out there who can help you, and whether you do it with your loved ones or you take yourself away to do it, it doesn't matter. The important thing is you ask for that help, because it is there, and that emotional support, mental health services, and financial services, the worries about money. That's where I was in that situation where I was diagnosed with depression. I thought I had anxiety. My anxiety was that it was me ill, physically broken, my wife ill, surgery, getting better at the time, and thankfully now clear, lockdown, and a whole load of other accumulated factors that left me in a position where I spent 2 years without any money. The 2 out of the 3 years after my surgery, I had no income, and that was terrifying. I now know that there are possibly ways I could have sorted that, which I didn't know about at the time, and I wish I did, but I didn't. So there you go. If you want to know details of any of these things, if I can't help you, I'll try and point you in the direction of those who can. But yeah, hopefully the next time we talk, I'll be able to give you some more positive news, even if that news is, oh God, it's in my bones and I've got to have chemotherapy, and if that's the case, that's the case. I think the average life expectancy after the surgery I had was 10 years, and I'm 6 years into it. And I don't think I'm going to drop dead 4 years from now. It doesn't feel like I'm going to. But it would be nice to have some bloody certainty about that, wouldn't it? I'll leave you with that. I hope you appreciate, yeah, I hope you appreciate how difficult this is to do, and that I will, honestly, if there's something I can do for you, if it's within my power, I will do it. Thanks for watching.